Back now on Triad Today, and I dare say all of us, all of you watching, know the term AFib, atrial fibrillation, either because you or someone or a loved one has experienced that, and or you've seen it on one of these medical dramas or whatever. But let's learn more about it with an expert, and he's right here with us. Nathan McGeathy is a cardiac specialist with Northern Cardiology, part of the Northern Regional Hospital family of providers, and we welcome you to Triad Today.
Thanks for having me.
So let's just ask the basic. What is it?
So atrial fibrillation is an irregular, often fast heartbeat that comes from the top chambers of the heart. It affects the contractility.
Yeah, well, now what are the signs and symptoms? I know when something's rapid or whatever, there are people that say, I can feel this, I can feel that. But for a casual observer, a loved one, whatever, what are the signs and symptoms?
So the symptoms can be generalized fatigue, shortness of breath, chest pain. A lot of people feel palpitations or like the heart skipping beats or fluttering in their chest.
Now, if you just don't pay attention to it, you think you have it, but you don't do anything, what are the health risks? What are the complications if you don't do anything about it?
So the biggest complication with atrial fibrillation is stroke. So when the top chambers of the heart are not contracting all the way, the blood can pool in there and a clot can form. If that clot gets dislodged from the heart and goes up to the brain, it can cause a stroke.
All right, so we're not doing a commercial or anything here, but let me just say straight out, if somebody thinks they're in that category and they feel these things, they should try to get in touch with someone like you, right? Or do you go to the ER? Do you make an appointment with your general physician, or what happens?
If you're feeling extremely fatigued or like you're going to pass out, you probably need to go to the ER for evaluation. If you're not certain you're feeling those skipped beats in your heart, or if you've had a stroke before and they're not really sure why, you should contact a cardiologist or a cardiac provider, come in, get an electrocardiogram, and maybe a heart monitor so we can see if you do have AFib.
Okay, now what are the treatment options if I have this?
So the first thing that we talk about with atrial fib is anticoagulation or a blood thinner. That'll help prevent a stroke. About 1 out of every 7 strokes is a complication from atrial fibrillation. So after we talk about the stroke risk and blood thinners, then we talk about medications to help keep the heart in rhythm or procedures to get the heart back into rhythm.
Now, we didn't rehearse this or anything. I'm just curious. Let's say you go on medication. Is that a temporary thing? Is that a lifelong thing, or what happens?
So the fortunate thing with the atrial fibrillation is that there's lots of treatment options that can be tailored to each patient's specific needs. So some of the medications are lifelong for certain people, and some are temporary. It just depends on each patient's specific need, which is why you should follow routinely with a cardiac specialist. All
right, I'm going to put some information up on screen. ChooseNorthern.org is the main website. Of course, Northern Cardiology, you can find Nathan there as well. But what I want to come back to in the remaining seconds is sort of catch you off guard here, because it's the first time you and I have met. We talked off camera about you going to Michigan, and I was kidding with you about that because you said your wife went to Appalachian State. But very quickly, what or who led you into the medical field?
So I had a lot of exposure to the healthcare field when I was younger, and then I went to nursing kind of as recommendations by my family. And after working as a nurse in the ICU for quite a while, I went back and became a nurse practitioner to help people out.
And in this specific specialty, anything in particular that drew you to cardiology?
I've always kind of had a fascination with how the heart works, and it's, an important organ that can cause lots of problems if it's not taken care of, and I want to help people feel good and live longer.
I think that's great. I just appreciate all you do, and I'll just mention one more time up on screen, ChooseNorthern.org. ChooseNorthern.org is the website for all those good folks, and not only find out about cardiology, but all sorts of things through that website. It's a great facility up there in Mount Airy. Well, will you come back sometime and visit with us?
I'd love to.
All right.
Absolutely.
Thanks for all the good information.
Yeah, thanks for having me.
We'll be right back.